to favor their intentions that are anti-people.
On Golding 97.5 FM, Yenagoa.
Good morning, Nigeria. Welcome to Let's Talk Nigeria on Golding 97.5 FM Yenagoa, your trusted platform for meaningful conversations. I'm Moye Stiving. Today we consider an important but often misunderstood health condition, and that is epilepsy, commonly referred to as seizure disorder. Yes, across Nigeria and many parts of the world, seizure disorder affects millions of people, yet it remains surrounded by myths, stigma, and misinformation. For many individuals living with this condition, seizure disorder, epilepsy, the challenge goes beyond the medical condition itself. It includes social discrimination, fear, and lack of proper awareness. In some communities, seizures are wrongly linked to spiritual causes or superstition, leading to isolation and, in some cases, denial of proper medical care. This misconception can prevent people from seeking the help they need and can also affect how society treats those living with the condition. Now, I'm going to leave all that medical term for the professional to talk about. And so you get ready for a very, very interesting conversation. So today we ask, what really causes epilepsy? How can it be managed effectively? And what should the public know to better support those living with seizure disorder? To help us answer these important questions, we are joined by the countrywoman doctor, Aibatari Agiri. Good morning to you. Thanks for joining us today. All right, good morning, Doc. Good morning. How are you doing this morning, though?
Fine, thank you.
Yes. So our goal is not just to inform, to educate, correct misconceptions, to promote understanding. We're also going to have you talk to us and for us to have this, very, very smooth in the conversation. So stay tuned as we shed light on this important health topic and empower our listeners with knowledge that can save lives and change perspectives. This is Let's Talk Nigeria. All right, so, Doc, what is seizure disorder? Like you said, well, you told me seizure disorder. I said, what is this lady going to say now? What is seizure disorder? And then you made it very easy. Epilepsy. So talk to us.
Seizure disorder is the medical term or name for what the layman or generally people call epilepsy. So basically what causes epilepsy is that first, it's chronic. It's not something that just comes and goes and that's all. It's not a one-off thing. It's chronic. And it is caused by unprovoked, recurrent jerking movements of the body resulting from abnormal activity or stimuli in the brain. In the brain, stimuli, electrical activity goes on, passing messages, relaying information. Eye, close, dirty wan enter your eye, close. Leg, move away, fire dey come, comot. The brain is doing all of that. So those messages are transmitted or relayed through electrical impulses. So with seizure disorder or with epilepsy, those impulses become abnormal. They don't go the way they are supposed to go. They become haphazard. So the person no longer behaves or does what he's supposed to do at that particular point in time. So it is chronic and it is recurrent. It comes every now and then, and it is caused by abnormal electrical activity in the brain. That's plus or minus what it is, simplified. And then we would go into, there are different types. There are different types of epilepsy or seizure disorder, so to say, depending on the part of the brain that is causing it. There are some that are focal, meaning just a particular focal, like focus, the word focus, focal. So a particular part, a particular point of the brain. And then there is the one that is generalized, both sides of the brain. And then there is mixed, focal and generalized. This might be a bit confusing for the layman, but the most important thing I would want to pass across is the two types that present, the way they present is different. There is what we call grand mal epilepsy. From the name grand, anytime you hear grand, your mind should go to something big, grandmother, grandfather, grandmaster, So grand means it's big. It's kind of generalized. That's the common one people know. Where the patient or the person falls and is jerking, foaming from the mouth, he is unconscious or she does not know what is happening. She just jerks and on and on. And that's the grand mal seizure. That's the general one. But there is the other one called petit mal. From the name, like I would always say again, petit, very portable, small. Petit mal is not like the general one where it is very obvious, the person is falling and jerking and Petit mal, the person will be looking at you, standing, just staring into space. The person is somehow not conscious, just out of reality, not in touch with reality. Breathing, just staring. Person doesn't know whatever you're saying, whatever is happening at that point in time, the person doesn't know. In fact, that one is very confusing. I would want to give an example that happened to someone very close to me, a relative, a family member. He had just gone into school, maybe 100 or 200 level, and one particular day the mother was talking to him, not knowing that he had had a seizure. They were talking and he just went silent and was looking at her. She was talking, he wasn't replying her. She got angry. She was waiting to worry you. She slapped him. He was still just staring. She got angry, called scary phone, called her sister, called this one, that look, this boy is like he has joined cults. Just imagine this one, that one. Meanwhile, now even nurse. The mother is even a nurse. When the guy later regained consciousness, he was like he didn't do anything like that. That the mom is lying. Nothing like that happened. They were not saying, why? It repeated itself again later on. because she is a nurse, that's how somehow they now linked it. Imagine that person wasn't educated and wasn't a nurse. How would that have gone?
So you're saying that when it happened that first time, she didn't notice it because
No, usually epilepsy happens usually from childhood. The onset is usually from childhood. The causes, let's even go into the causes or the etiology.
What triggers the seizures?
Of epilepsy or seizure disorders. One is genetic. That's why in those days, especially in certain parts of this country that I wouldn't want to specifically mention, but most parts, if you want to marry, they will say go and vet, go and check. Epilepsy is one of the things they will say that family then get epilepsy. It's one key factor. It's genetic. So if one man or woman is epileptic, it can pass on to, so it's in genes. Epilepsy can be genetic. And then it could be from prenatal issues, that is in utero. As woman get belle, there are certain conditions that can cause the child to become epileptic when the baby is eventually born. Malnutrition, certain kind of trauma, some kind of drugs, and then hypoxia during delivery, all this prolonged labor, 2-3 days you are laboring, the child is lacking oxygen in the brain. And so most times when a patient presents, the first history we start asking is where you born the pikin, how the labor been go, this one, that. You'll be wondering, like, what is the business with my pikin where they get convulsion at the age of 8 or 9 or 10? You're asking me of when I born am, how the labor, how does it relate? But it's a causative factor. So when there is reduced oxygen supply during labor, it also predisposes the child eventually when born to epilepsy. And then there are other causes like infection, meningitis, HIV, viral encephalitis. Viral meaning virus. Encephalitis is inflammation of, to break it down, or I don't know how to simplify it, but it has to do with the brain anyway. And then the meninges is a layer that encompasses or encloses the brain. So meningitis is when it is inflamed. It could trigger epilepsy as well. And then there is, of course, head trauma. Head trauma is one of the major causes of epilepsy in adulthood. In childhood, it usually comes with the prenatal or in utero causes, maybe maternal malnutrition, maternal trauma, and all that. So from childhood, the child just starts having, as the child is growing up, the child is having epilepsy every now and then, convulsions, falling and all that. But there are some that start in old age, probably after a trauma. Somebody hits your head, flog you, knock you akpako 2x2, or maybe an accident.
Oh my goodness. Unlike akpako 2x2. Which one?
They knock you akpako waiting no nice. So head trauma is one of the reasons. And then there is tumor. When the tumor grows somehow in the brain, it will impair and disturb the normal electrical activity or impulses in the brain, resulting in epilepsy or seizures. There are also blood vessel malformations. Instead of the normal formation of the blood vessels, if they are not formed the way they are supposed to be, it could also it will impair or affect the normal flow or impulses of electrical activity, and hence cause. Also, it is common in extreme of ages, meaning low or high. Extreme, low, extreme. So the very aged or elderly, or the very young or infants, neonates. in children, fever is one very major cause.
Of epilepsy.
Yes.
Which of them? The mild one, or the
Not-
petite one, or
Not
the grand?
the petite, grand mal. That convulsion that you see
Hmm.
is because of fever.
Okay.
The child just starts convulsing. That's because the fever has gone so high. So for children, you avoid fever as much as possible. Whatever illness, even if it's as simple as malaria, avoid the child getting high temperature, naked the pikin. In fact, in standardized hospitals or settings, pediatric wards always have AC. It will be chiller than this studio. This your studio, they learn work. And parents will be like, this place is not good. But that's how it's supposed to be. In extremes of ages, very elderly and far much children. So basically, those are the causes: genetic, prenatal, malnutrition, head trauma, infections like HIV or tumor in the head, viral encephalitis, meningitis, and all that.
Are you
So-
serious? Infection with HIV as well affect
Yes.
cause a seizure
Yes.
disorder? Wow.
Yes.
Interesting.
When it progresses to AIDS. Yeah, not just the HIV infection.
Okay.
I could be HIV positive for 20, 30, 40, 50 years, get old, and old age meets me, I go, without anybody knowing if I'm taking my medications and doing what I should do. But once you don't do that and you let it progress to AIDS, epilepsy, seizure disorder is one very common. In fact, most times that's how some family members get to know. Some people will go, they hide them. It will now lead to that seizure disorder, encephalitis. They will just fall, start jerking. Because you don't know yourself at that time, the patient's relatives will take you to the hospital, and because you're unconscious, by the time they start doing investigations and they find out, they can't speak with you. They now have to talk to the patient, the relative that brought you. This is what is wrong. This is what. It's from there the relative will now get to know that
the person is HIV
yes,
and has got to AIDS.
and it has gotten to AIDS because the person is at that point unresponsive. So you can't just be waiting for the person to, so it is one very major cause.
Wow.
It happens a lot with HIV that has progressed to AIDS.
But there's this misconception. How can we correct these misconceptions about it associated with superstition?
The myths. I still remember when I was in, is it primary 3 or before? Because of these myths we have that it is communicable. There was a boy that had epilepsy in the class. He fell one day with all the spittles and whatever coming out from the mouth. And no waka that part of the class until we pass come out from that class.
Are you serious?
I was avoiding. Everybody used to avoid it. Me gone. I won't go close to. In fact, that place he fell. They say if you look at the spit safe, you contact it. That is how bad. It was until I had grown up and got to know that all those are myths. It's not communicable. It's not communicable.
It's not even spiritual.
It is not spiritual at all. It's not a spiritual attack.
No, because
That's why most times some people call it spiritual attack when it starts mid-age.
okay.
Sometimes you don't even know you had an accident, maybe something, you hit your head on the wall, or a car hit and then you had your head hit something. No serious injury, nothing, but head trauma don't they? And then later on you start having seizures. And the next thing is it's spiritual attack. Because most times the knowledge is now from small they come. But this one midway in life, nothing happened. You can't even remember that.
It was because of that.
Trauma, people don't
whatever.
know that head trauma could lead to epilepsy. So they will be like midway in life, epilepsy just come. It's a spiritual attack. Then throw arrow. So it's not a spiritual attack at all. It is
Wow.
not.
Wow.
And it is not communicable.
Wow.
You can hold somebody that is having epilepsy or a seizure disorder and nothing will happen to you. Now, one very bad thing very bad thing we do in Nigeria with epilepsy. The discrimination and the resuscitation method, the way we manage it. If you see where then they press who they get seizure, oh, as a medical personnel, you pity, you get angry. I know of a lady that lost one of her eyesight.
Because of what?
Because they were trying to
revive her.
resuscitate her. When somebody is having a seizure, no be the beating, no be the pin where you choke the person. It's not the flogging. They will burn you fire. They will cook pepper soup on your life. Scent leaf, onions, palm oil, crude oil.
Crude oil.
Yes, there is this oil they call condemned oil. I don't know how they get it from car. Whether
Okay,
I don't
yes.
know.
It's an engine oil like
Engine oil that has
have been used and then-
the hair. It's
Yeah.
black. All those man, they will put it in your mouth, put
Huh?
in your ear, put in your eyes. Seriously.
in your mouth.
Yes. They will burn. I said this lady, they pressed her eyes until
She lost it. She lost one of the eyes.
Yes, eventually. She went blind. That eye, she lost sight in that eye. There was another lady that was admitted. She had a seizure episode, epileptic episode. Eventually got herself. The reason she came for admission, and she was on admission for a very long time. Waiting will come the treat now saw because of the fire where them burn her.
You doctors are seeing a lot of things. You're seeing a lot of things every day
Fire where them burn the woman
to resuscitate
to
her.
resuscitate, and they will be very happy and proud. Now if not be the beating, oh beat her, if not be that fire where burn her, I get to chook her pin now. Now I make she wake up, and you'll be telling them thank you.
You've seen thank you.
You'll be telling them thank you because they helped you come back to life.
Oh, okay.
That's what you think. That's what the patient is thinking. That I'm even lucky. If not for these people that blinded my eye or burnt me with fire, I would have been dead. You don't need to do anything to anybody having a seizure, an episode. Just make sure the person is safe, lying or in a position or a place where he or she does not injure herself or himself. No sharp object around, no hard object that during the jerking you can hit, something will fall on the person. Let the place just be free. Don't even gather the person. Let there be free flow of air. It will eventually end.
It will resolve itself.
It will resolve itself. Once those electrical activities in the brain, once that time passes, it will end. If it's an episode that will last for 30 seconds or 1 minute, and you carry mortar pistol, it won't make any difference. That 30 seconds must elapse before the person will get back to him or herself or regain consciousness.
Wow.
So it's something that really needs to be talked about.
No cure for epilepsy.
There is actually no permanent cure. It can only be managed. It can only be managed, especially the genetic type or the in utero, the ones caused by maybe maternal malnutrition or something from the womb. You just manage them. But if it's something caused by what they call it, tumor, for instance, if it's a brain tumor that's causing it, if you take it out, that would solve it.
So are you saying at some point in your life this
Yeah.
thing will not naturally resolve on its own?
No.
Because some people will say, okay, at some point I had this experience. Some people will say I had this experience, but at some point in my life it was somehow resolved. I no longer experience it. We've heard of a lot of testimonies here and there that say, oh yeah, I used to be an epilepsy patient, and at some point everything was resolved. Can that happen?
It's probably not true. For children, like I said, children can have convulsions. That's not necessarily epilepsy. In kids, it's very common. Once they have fever that's very high, they can convulse. Eventually, they will outgrow it. But that an adult who had a head trauma, or there is a tumor in the brain, or a child that had in utero or genetic epilepsy that was born and has been having epilepsy from childhood, that at a particular age or at a certain point in time, it's then maybe not the miracle way then they talk about, but medically speaking, no.
Okay. Now, are there warning signs before a seizure occurs, and can they be prevented? For instance, you as an individual, you've got some signs that this is about to occur, and you can prevent it.
Sometimes no. Sometimes there are signs. Patients will tell you, I used to have this feeling, I know it when it wants to come, but the bad thing is it's a very brief. As you they feel it's a matter of seconds, not even minutes.
It is happening.
Yes,
you can't control it.
As you they feel before you even look for somewhere to just rush and sit down. Some do have what we call aura. One common one is this: they will tell you they perceive like burnt tire, as if when you're burning this car tire, that smell or smell burnt plastic or something, they tell you they perceive that kind of odor. Meanwhile, there is no such burning going on anywhere.
So it's just happening in the brain.
Yes, they just perceive that kind of smell, and in a short while, so once they perceive this thing, some of them they have our aura. For different persons with their different aura, they feel it, they get the sensation. So if you're fast enough and you're in a safe place, maybe if you're at home or you're amongst people who know you have that issue, you could quickly tell them, and as you they talk, if it don't already they happen. Or if you're at home, as you are feeling it, maybe you just lie on the floor, and it will eventually, the episode will just happen and eventually end. But that you will feel it, get the aura or get the sensation, and it will give you enough time to get yourself comfortable, and it's not like that.
Someone would say that the petite is kind of none of them is all right, but like preferable to the grand.
Of course,
like
you
can
think about it.
You could you
Petite
there's no
mal
formal
is
embarrassment somewhere. Just
petite mal is far better. You just, it's like you are in a trance. You are not jerking, you no fall, nothing. But grand mal, my dear, you're on the ground, you're jerking with spittle coming out of your mouth. Like this, my family relative I was talking, there was once he said it happened in school, right in front of the university gate. He lost money. By the time he got to know himself, even in that kind of situation, people they palm phone. By the time he got to know himself, his phone wasn't there. He was going to buy something. There was no money. They don't beat and wound them. So he went back home with injuries. If it is petite mal, you just go into trance, and after some seconds or a minute or two, you're back to yourself.
So when they travel, such individuals, for instance, when they move in public spaces, the buses or whatever, how do they, I don't know, have you interacted with anyone who, because I have not, but like, have you interacted with people who are managing such conditions, how they are able to cope when they get to public transport system, when they use public transport systems? Because when if that occurs there, what happens to, how would the people?
That's where the psychological part comes in. It's a very debilitating condition.
Especially ground.
You want to travel, you think at every point in time you are scared. Supposing this thing happens now,
in the bus
it's
or
always
like
on your mind. You're always thinking about it.
Ah.
Supposing this thing happens at this point in time, instead of focusing on what you're doing, maybe you're supposed to be studying or reading or listening to a lecture, your heart go that side. Supposing this thing comes, so in Nigeria, if it happens in the bus, they start beating you now. Then bring fuel, pour you, carry lighter, light your leg, beat you. Eventually, you get to know yourself. Your clothes are torn. They will press your. They press one lady's jaw. She couldn't eat for days. She could not open her mouth. They press the living daylight out of her. Put spoon. You see that spoon?
The spoon,
they'll put spoon in the mouth, cut all your tongue, bruise. She couldn't eat. It was so bad. They even dislocated her jaw. There is what we call the temporomandibular joints, TMJ. They pressed her so much, they dislocated the temporomandibular joint. she no fit open her mouth close again. It was that bad. So a seizure that lasted for barely 1 minute or maybe a minute and few seconds.
And you got all of those bruises and all those.
You have those bruises, and you are now treating. You now have to go for surgery to fix TMJ.
And that's not going to be the last time that's a kind of seizure will occur.
Of course, it will happen again. So that's why we need awareness for people. Everybody, public needs to know that it's not communicable. So don't run away from the person, and don't beat. Don't flog, nothing. Just let the person be safe. Let there be no sharp objects around, no hard anything that will injure the person. Just allow the person, not even hold am. Leave the person to jerk as much as he or she would. After a few seconds, a minute, 2, it will eventually wear out. It will stop. Your beating won't make any difference. It will only worsen the person. If you don't beat or anything, once the person comes to, he will just know that, oh yeah, it's like I fell again. That's all. But by the time you beat, you press, you burn with fire and this and that, as the person get to know himself, he's feeling pains all over his body. So that becomes a reminder. For weeks, he's treating or still feeling the pains of the massaging, the pressing, the fire that was burnt, and all that and all that. They will say your eye they roll. So to prevent that, like that lady that I said she lost her eyesight. That the eyes were rolling. So they were pressing it.
Like they rolling because she wants to pass.
Yes, to them that you know when you pass, when your eyes roll and the black go like this, one thing, you don't mean it means you are dying. So they were stopping it from rolling. That was the pressing. They pressed all the blood vessels in the eye, burst this woman, pupil, retina, everything scattered. She lost her eyesight. Put spoon in the mouth, they will twist your tongue. It's crazy, but it's something that we need to know that epilepsy is not communicable. You don't need to abandon the person. Touching the person won't make you contact it. I'm not saying go and use your bare hands to touch the person's spittle or it's not like it will it will make any effect or it will you contact it. But then it's not just hygienic. Even if I'm not epileptic, if I pause spit, say big person, it doesn't make sense now. So epileptic or not, you shouldn't be touching but to help the person, straighten the person, move the person to a safe place, and it should be done. It's no need to beat. So just give distance, let there be air.
It's beautiful we're discussing this, and I want to really appreciate you for this topic. It's indeed enlightening our people, those listening to this radio station. I think this is a whole lot of information for us. It's going to really help us, and going forward, you would know how to manage this kind of situation. We'll be opening phone lines now. Let's share some experiences in case you've got 1 or 2 questions to ask as well. You could ask the question. If you have an experience to share, why not? You could do that right away. 0707 747 1522 and 0912 000 1975, or you can send a message to our WhatsApp number 0912 000 1975. Let's hear from you. It will be nice to hear your own experiences and to tell your own story, maybe someone else's story as well. Hello, good morning.
Hello, good morning, Golden FM.
Good morning.
Yes, I greet our beloved guests in the house. Doctor, well, I know anytime you come to the studio, I abandon almost everything I do just to listen from you. And today's topic is very important because it's just within us. And thank you for enlightening us concerning this particular issue. It's a very, very important issue. You see, because I've witnessed 1 or 2 occasions like this. You see, with my common sense, even when it was happening, all I could tell the people around that, please, please give their space. They used to gather them. Just give the person space to have ventilation. That is one of it. But my question is this: what triggers epilepsy? That's what I want to know. Please.
Okay.
Thank you and good morning. I still remain reporting for.
All right. I think Sabera, she mentioned it from the beginning, but fine. She's going to reiterate. No problem. But let's take another call. Hello, good morning.
Hello, Golden FM. Good morning.
Good morning.
I think my name is Shikobi. I'm calling from Obale.
Welcome.
Yeah, I want to make a request. But before my request, I want to thank that sister. I want to thank her very well. Because if I share a story of this epilepsy, my brother is a big problem in the society. Back in the day when we are small, that age, within that 12, 16, all of our age mates get this sickness and they fall inside fire. He was frying Gary. He said, start. The man fall inside, the boy fall inside fire. Can you imagine? None of his age mates agreed to play with him again. None of his age mates agreed to share anything, even food, with him because of that sickness. So I want to beg our radio station, that our sister, to be repeat this thing so that people will get more knowledge and know how to that kind of sickness. See the kind of drama where this guy get from age group because of that sickness. My brother, as he just a talk, I just a flashback what happened that time. That was that kind of rebel on 94. As he just a talk, we will really avoid this boy totally because the fire boy in head, nearly to touch his brain, all the 5 fingers cut out on fire. Nobody was. After that, nobody ready to mingle with him again to do anything. Even after some years, 3 years, 4 years, when we don't go outside town, come back, we will get the courage to eat together with him. Man, the pattern of it is because you know say that is still there for our body. We not go green like to turn the soup around. Man, it was terrible. It was terrible. We really avoid that boy too much.
Okay.
So I want to beg. No,
all right.
Repeat this program.
Oh, no problem. All right, Chikobi. Appreciate you. Thank you. Well, yeah, that's what we do here at Golden FM. We try to educate because, of course, radio is all about, or the media is all about, informing, educating, and as well as entertaining. But this time around, we're educating you. It's really a serious matter we have to look at on a daily basis. Hello, good morning, and welcome to the show.
Good morning, Golden FM.
Good morning.
Yes, we appreciate you for this lighting program on this disease condition, especially the doctor and your management who is always providing this lighting platform for the public.
Yeah.
What I will actually want to ask about this, what you have specified on the condition of the chronic and the petit, because she separated them. Can the petit graduate to the chronic with time, or that is just the stages of operation? I mean, concerning the electric seizure or whatever.
All right, so that is going to graduate from the petite to the grand. That's what it's asking. You want to answer all the questions, but let's take another one before we go for a short commercial break. Hello, good morning.
Good morning.
Good morning.
Good morning.
Good morning.
To the guests in the studio. Senior comedy, the chance on the line.
Welcome.
I said something on Facebook. You did not read it too.
Okay, you did.
I said.
Okay.
I lost my cousin sister.
Okay.
This problem. Then we are eating. We do eat with her. Do you know what we do, Moye? We are scared even when we are eating with her.
Are you serious?
When the food want to finish, we don't want her to feel bad. But when the food want to finish, every one of us will just give ourselves eye contact and we leave her. We are scared so that she will not go and bite us or something. Before you go, we are looking for spoon, do this, do that. And at the end of the day, after years, we lost her. That is not okay. Can this sickness be completely eradicated? Because in the family, doctor said it's hereditary. But in the family, nobody has had it. Nobody. She's the only one. So how do we solve this problem? Then again, secondly, as a teacher for years, I've encountered so many students. While teaching, the next thing, this boy started turning around. He fell down on the floor and everybody ran away. And later we came back and started blowing in with hand fan. Some we carry stick, hit the child. Before you know, they will wake up with some injuries, just as what you said. Then another one was a girl. That one I deliberately called the father. I called him and said, your daughter is on the ground. You know what he told me? He said, teacher, don't touch her. Just lie her down, don't touch her. Nobody should beat her for me. Then after some minutes, she woke up. But one thing I discovered, when they wake up, they become ashamed. Nobody wants to talk to them in the class. Secondary school boys and girls. Nobody want to talk to them again. This is a beautiful girl. Nobody want to talk to her. Nobody want to sit close to her. So this kind of sensitization, I think it should go around. Because usually the secondary school students, they won't talk to you again. They won't go close to you. You will be topic of discussion for the next 10 years. Till you finish that secondary school in that community. How do we solve this problem?
Okay.
Well, thank you for this teaching. Thank you.
Thank you very much, Avi Charles, for your narrating your own experience. Let's go for a commercial break. When we return, we'll take more calls, both on Facebook. Avi, I saw your message now on Facebook. Thank you so much. You can also go to our Facebook page. We're streaming live, 97.5 Golden FM, and drop your messages. We'll read them when the time comes. Let's go for a commercial break. We'll be back.
This is 97.5 Golden FM, the gold standard of radio. Feel the rhythm, feel the gold. 97.5 Golden FM by Yelsa's Music Powerhouse.
Please listen to this obituary announcement. The Pogo and Ogbogoro families of the Aya group of chieftaincy houses of Ewama Kingdom, the RC family of the Idumangi group of chieftaincy houses of Opoma Kingdom, the Eketekbe family of the Eminingi group of chieftaincy houses of Odioma Kingdom, the Waribuga family of the Cameroon group of chieftaincy houses in Tuon Brass Kingdom, and the Okoto family of the Seofoni group of chieftaincy houses in Egwema Kingdom, all in Brass local government area of Bayelsa State, with a great sense of loss, but with total submission to the will of the Almighty God, regrets to announce the death of our dear son, brother, cousin, nephew, uncle, father, and grandfather, Rear Admiral Alfred Aibemi Samsele, retired on the 27th of February, 2026, at the age of 68 years. His burial arrangements are as follows. Service of songs on Friday, 20th of March, 2026, at the Chief DSP Alamesia Banquet Hall, Government House, Yanagua. Funeral service on Saturday, 21st of March, 2026, at Tulda Hotel Open Ground, Ekeki, Yanagua. He is survived by 3 children, 2 grandchildren, and a host of relations too numerous to mention. This is signed by His Royal Highness Chief Okuromo Sam Dawai, family head and Amayanabo of Ewama Kingdom, and High Chief Inikyo Samsele Dede, elder brother.
Cruising around by Yelsa on 97.5 Golden FM.
Welcome back.
You ready to start this show? Back to the music faster
On 97.5 Golden FM.
Welcome back to Let's Talk Nigeria. We're looking at seizure. Yes, seizure disorder. You could call it epilepsy. And Dr. Aibatari Giri has done justice to it. And we thank every one of you who have contributed. You're sharing your stories. We still have more stories being shared by the listeners. Here is Pedro A.B. Peter from Elebele. He said, good morning, Golden FM. I witnessed an epilepsy case at Opolo Market. The poor man was being flogged by a crowd until I intervened. I quickly loosened his restricting clothes, removed his tight shoes and wristwatch, placed him in a recovery position to let fluids drain freely from his mouth, and asked everyone to step back for better ventilation. He regained consciousness shortly after, but was so ashamed. Thank you for this program and our wonderful doctor in the house. Let's keep spreading vital medical information on all kinds of topics. I always enjoy her insights. Now another David West sister, she funny die. Which one be them knock you 2 by 2? Something we're no good. All right, thank you very much. Kudos to her. And thank you so much, Pedro Peter, for your message. Here is another one from King Azikuru. Good morning, Golden FM. Please advise for those who are drivers and they have these epilepsy issues. I don't know if someone who has this issue should drive. Maybe doctor's going to help us out with that. Thank you so much, King from Azikuru, for reminding us that. Should we take a couple of calls before we come to you answering the questions as a way of rounding off? I think that's going to be the best way to go about it. Let's take this call. Hello, good morning.
Good morning.
Good morning.
Michael from Apollo.
Michael from Apollo. All right.
Please, I want to make clarification from the doctor.
We can hear you. The network is pretty poor. It's pretty poor. No, not at all. I don't know. We're having a challenge with the reception there. You can probably call back, okay? 0707 747 1522 and 0912 0001975. Let's take another call. Hello, good morning.
Hello?
Hello, good morning.
Yeah, good morning, Maurice, Stephen, and your guests in the studio.
Good morning.
My name is Jackson. I'm calling from Merindiro.
Jackson.
Thank you. Doc, thank you very much for this information. While I was young, the sales boy that was selling for my mom, he actually has this epilepsy, but I really never knew how they should be caring for somebody in that kind of condition. But I actually eat together with him, we do all manner of things together. My mom was aware of his situation, even I myself was aware, but I did not have this feeling of neglecting him or being afraid of him. Though I've not seen him under that kind of situation, but I know that he has it. But he has not manifested in my presence before. But now I'm coming to understand that you don't need to touch the person, you don't need to pity the person, because I was thinking all of the revival of those with this situation is based on the flogging, based on the beating and the rest of it like that.
Okay.
There was once I remember how they put all manner of things. Some of them, they put snuff inside his nose. They put all manner of things inside the body of this person to wake up. All of our mind was these treatments were the things that were reviving this person. So,
okay.
in fact, I want this thing to be amplified more than just being in one particular radio station.
Mm-hmm.
Because a lot of persons are going through this situation of being humiliated, injured, and the rest of it before they think that they finally recovered. So I really appreciate that for this information.
Thank you very much. Well, that's what you get on Golding FM. That's what you get on Golding FM.
So after this last callers, if I have my way, if I have the funds, if I have the resources, I think epilepsy is something that should be talked about, handled, enlightenment all round, because the discrimination, it's not funny.
Not funny at all.
It's not funny.
Oh, yeah.
And the other question about driving, it shouldn't, because you don't know when it will come.
So
you should not be driving.
So if you are an epileptic patient, please don't drive.
There are certain things you don't even do. You don't go fishing or go swimming alone. You have to go with people who know you have that, so they always have their eyes on you. The moment they see that you're having, they take you out of the water and then lie you. You shouldn't be cooking. You shouldn't be anywhere.
There are some occupations you don't do.
No, you don't. There are some occupations you can't. You can't be working in a factory where machines do this, and even people who are not epileptic mistakenly hand enter here, this one, that one, talk less of you. So there are some occupations you can't be, involved in.
Okay, hold on. All right, let's take a message because if I don't, I will be crucified. This one is from Israel Obrebru. Good morning. This is on Facebook, right? Obrebru, you said, good morning. Please, I want to know if putting onion in the eyes of the person is good during this process. Of course, doctor, it's not good at all, right?
Nothing.
Never.
Just
don't
leave
do
the
it.
person. Not even water. As a matter of fact, there are some people that will even die from aspiration. They will tilt your neck and put water, some will press scent leaf, some different types of fluids. When you're putting that into the person's mouth, it will go to the lungs. The person aspirates and chokes to death. That is what kills the person, not the seizure.
Not the seizure. All right, hold on there. This one is from, it said, dear Dr. Steve, your questions had left me with no question for the guest and her answers too. have been so explicit and need no further explanations. Thank you all, and I feel your guest should be teaching in a medical college. Well, just the way, because she knows how to break it down.
My mother was a teacher. My mother's parents
Well,
were both teachers, headmaster, head.
So she learned from there.
Mistress. So
But-
you have no choice.
Well, maybe someday she might be in a medical college teaching, but you never could tell. For now, well, she's not in a medical college, but she's a medical doctor doing a thing in a hospital. But let's take, should I take another text or another call before we
The
call it a
question that
day?
asked about what causes the etiology, like we say, genetic, prenatal. A woman is pregnant, she's not eating well, she's malnourished, she's not taking the right drugs, hematinics that she should be taking, she's beaten, husband go knock her, all those kind of things, they affect the child.
The child. All right, let's take this
You
message.
hit a child and then on the head,
Yeah.
in utero.
Hello, good
Child
morning.
is born with.
Good morning.
My name is Jim. I'm calling you from Akempa.
Welcome.
Okay, I have two things to talk about.
Please make it brief. Make it brief. We're about going.
Hello?
Yes, could you please make it brief because we're about going?
My niece is somehow having epilepsy. I've called the father that this thing supposed to go to the hospital. The father said
It's spiritual.
this is a spiritual matter. I say spiritual matter. Can't the doctor handle it? Anytime I talk to him, he takes offense that this is spiritual matter. He's trying to even apportion blame to some people that these are the cause that his daughter is having like this.
Okay.
Are you getting me?
We get it, James. Yeah.
Sir. No, just
Are you
take.
getting me?
Yeah, we got
We
it.
heard you, sir.
We heard
Just take note that epilepsy, though it doesn't have cure, but it can be managed. And when you're placed on medications with the right dose, you can't just get the right dose. It's not a one size fits all. There is the dose you give to Mr. A or patient A that it will control the seizure, but with patient B it won't. So we titrate. If you give and it stops, it doesn't, you maintain that dose. If it does not if it still recalls, you step up. When you eventually get to the point where the patient is no longer having seizures for 6 months, once a patient is seizure free on medications for that period of time, the person we more or less say the person is cured. You take every day for that period of time, and there is no, you're seizure free for 6 months, 1 year, and then we step back down. It won't be every day anymore, and it can be managed,
You can, right?
and the person will live a normal life.
I think we'll have more people. We might come again to continue. I think there are more things to say, isn't it? Apart from asking questions, is that all that we need to say about epilepsy, Doc?
In 1 hour, no.
No way, right? So we're going to be here again to
Maybe,
look at
yeah.
it. And I will dedicate that day for a lot of, because a lot of calls are coming in, a lot of messages are coming in right now, and we just have 3 minutes to go. We can't take all the calls, but I assure you we'll be back again next week to look at this issue. We'll continue from where we stopped because there are a lot of things to talk about. I have a lot of questions I wanted to ask you. And sincerely, I've got like 5 more questions. So many questions to ask, but let's just keep it for another day. But thank you so much, Dr. Imataria Giri, for coming today. You heard the people. They want this over and over again, and, to keep educating our people, enlightening our people on how to manage such situations. For the last caller, I know you still have more things to say, but when we come back next week, hopefully, you should come up with those issues. Let's talk about them. All right. Thank you so much once again for coming on the show.
Thank you for having me.
And of course, I am your man, Moye Stiving. Thank you so much. Let's Talk Nigeria will be here again tomorrow. Make sure you enjoy every bit of our programs today.